So I'm Dr. Eyal Zimlichman. I'm a physician, an internal medicine physician, and my role is Chief Innovation and Transformation Officer at Sheba Medical Center, Israel's largest hospital, ranked as one of the top 10 hospitals in the world.
Yep.
And I'm also the founder and director of the ARC Global Innovation Program.
Amazing. It's great to see you here at HIMSS, and Sheba always seen as that, iconic Center for Innovation and Healthcare in Israel. Tell me about what brings you to HIMSS and what are you excited about?
So, HIMSS is our usual platform. We come every time to HIMSS, but this year it's a little bit more special. We came in with an announcement of what we think is transformational technology using generative AI together with our partners, KPMG and Microsoft, to have a patient-facing application in the mental health space that's able to really move the needle on access and quality of care to large populations.
Yeah. Actually, so generative AI all the rage at the moment, and it's one that there's a lot of potential, but it's difficult to see like the real-world practical applications right now. Like where do you see this kind of innovative technology happening? Is this something that we're going to see in a couple of years' time, or is this something that's happening now?
I think it's coming along very, very quickly. I say machine learning or proper AI, as we've known it before Gen AI, was sort of an evolution, right? It was slowly sort of seeping into healthcare, creating an impact. Gen AI is a revolution. This is something that will come in very, very quickly. And we've seen the capabilities. I mean, it's just been over a year since this announcement was made by Microsoft and OpenAI. And already we've seen huge advances, starting from GPT-3 all the way to GPT 4.5. The abilities have really, really increased. And that, of course, is very interesting to think about what's going to happen in the next couple of years, having this trajectory continue.
Yeah. And tell me a bit about what this use of Gen AI will practically look like. How will people engage with it? What is the thing?
So specifically what we're releasing, or the evidence we've released during the HIMSS conference, we're looking at and developing a tool that's a conversational app, patient-facing, where you have the Gen AI speak with any patient. That after a conversation of about 20 to 40 minutes on average, the Gen AI is able to make a diagnosis or recommend a diagnosis, is able to recommend a severity for that diagnosis, and also recommend treatment, both medication as well as psychotherapy. This could serve many, many purposes, right? I mean, this is just the capabilities we've shown in the clinical trial, showing more than 90% accuracy in the Gen AI compared to human psychiatrists. Where do we take this next in terms of applications? There's a wide array, and of course, initial applications will be more careful that we are not hurting anyone. That's primary on mind, of course. But then with time, we think this will actually have even more applications. And as we know, mental health suffers with huge amount of issues with accessibility. This could be really game-changing in that regard.
Amazing. Yeah, look, I mean, I can see the potential for increasing accessibility. We've only got a limited number of human clinicians that can see patients. Where do you stand on, often when we talk about AI and ensuring safety in AI in healthcare, we always like to incorporate, say, a human in the loop in the process of diagnosing a patient and having the AI as the intelligent assistant for that. Where does that fit in with this particular model where the Gen AI is diagnosing after a long consultation with the patient? So
this would serve as a decision support for doctors. Of course, the Gen AI will not write a prescription for a new drug for a patient or even make a diagnosis and give that diagnosis to the patient. What we're seeing is two uses. One is, of course, to help the clinician make better decisions. That's number one. And we're already doing this with more of the traditional AI for a couple of years, so that's nothing new. But the other thing is, with accessibility issues, if you are seeking mental health care and you want to set an appointment and you get an appointment set for the next month, that might be too late for many patients.
Yeah.
So right now we're missing a lot in terms of providing the right access to care for patients who really need it. So imagine when you're looking to schedule an appointment, somebody is able to triage and say, listen, you have to see the psychiatrist tomorrow, please come 9 a.m. Versus you're fine with waiting a month. Here are some digital tools we can give you in the meantime so that you're not left hanging in terms of some capability to answer your problems.
Well, and that's what we do in healthcare now, isn't it? The triage, perhaps with a nurse or with a technician or somebody to be able to streamline that process for the doctor to make the ultimate, kind of decision and continue to do care in a scalable way. If we can do that more effectively, technology that makes a lot of sense. I know you need to run to go to the airport and have a thing, but lastly, can you tell me about like what's coming at Sheba? What are you excited about, and maybe where can we see you next?
So sure. So, basically ARC, our innovation platform, which is now active in almost 20 countries with 160 partners around the world, we're looking to transform healthcare. We're looking to answer to the many critical issues like the ones we just talked about with mental health and accessibility, but there are many, many others. So we're looking for those game-changing technologies, and AI definitely is a primary goal right now. It's a focus area for us, but not just that, also remote care. And we also talked here during HIMSS, as we talked more about mental health, about our hospital-at-home programs for mental health. Huge issue because we know the stigma of patients who need to get hospitalized for mental health treatment. There's a huge issue with accessibility, for example, for eating disorders to get the high level of care. There's huge issues with accessibility to care for postpartum depression after pregnancy, where sometimes the child and the mother need to be separated because the mother goes into a psychiatric hospital if she's in a severe condition. How do we move all of this to the home? Given the technology we have today, given our ability to do risk assessment and know who's the right patient for a home environment, we're able to move about 50% of the patients today that are hospitalized to the home environment. And of course, in mental health specifically, that's a game changer. So this was sort of a deeper dive into mental health, but the same thing is ongoing with ARC around the world in many other domains.
Yeah.